What was your journey to becoming a genetic counselor?
Hi, my name is Bryana Rivers, and my journey as a genetic counselor started by first receiving my bachelor's in cell biology and molecular genetics at the University of Maryland College Park. Afterwards, I worked for 2 years as a genetic counselor assistant in a cardiovascular genetics clinic at Johns Hopkins. I then went on to do my master's degree in medical genetics at the University of Cincinnati Genetic Counseling Program. Since then, I've had a couple of different roles, but my current role is back at Johns Hopkins as a cardiovascular genetic counselor.
How did you choose your genetic counseling specialty?
I chose my genetic counseling specialty because, as I mentioned previously, when I worked in a cardiovascular genetics clinic at Hopkins, I really got a full immersion into what it's like to be in that space. And when I went to grad school, I really wanted to know a little bit more about the other specialties, and I really wanted to keep an open mind. But I just kept coming back to cardiovascular genetics. And I was interested in pediatrics, I was interested in cancer, but there's just something about cardiovascular genetics and just so much more to learn in this emerging specialty that kept drawing me to it.
What does your typical workday look like?
I have a few half day clinics per week with 3 patient slots in each clinic. My role is split 50% research and 50% clinical. So when I'm not in clinic, I'm working on a couple of research studies that we're actively enrolling patients in. I often also will supervise students, and any day can look very different just depending on what's going on that day.
What is the most challenging aspect of being a genetic counselor?
One of the most challenging aspects of being a genetic counselor is witnessing this limited access to genetic counseling services for our patients. Some insurance companies have better coverage of the testing itself, but not the pre test genetic counseling visit. And I never want to be the barrier to a patient having access to genetic testing.
What do you like most about being a genetic counselor?
What I really enjoy about being a genetic counselor, especially in my current role, is merging the research space and the clinical space. There are a lot of things we see clinically and anecdotally that through the usage of research registries, we're able to study in an organized way and contribute to the current knowledge base of the clinical implications of certain genetic variants.
What advice do you have for aspiring genetic counselors?
What I've always admired about this field is genetic counselors' ability to demonstrate their utility in spaces where genetic counselors may not have previously been considered. We see that with the growing number of clinical specialties or genetic counselors in policy or research. My advice for aspiring genetic counselors would be not to limit yourselves in your job aspirations. Carve out your space and find your passion in this field, even if it means spearheading your own subspecialty.